Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. For this video, what I want to talk about is how to optimally manage your scar after knee replacement surgery. So in particular, this video is going to talk about managing your scar after the first couple of days or first couple of weeks. So your scar is no longer a wound and it's no longer a scab, but it has turned into that phase where it's in the remodeling phase. So now it's starting to lay down new collagen and new soft tissue, connective tissues, and it's starting to remodel and change its appearance from kind of that red purple color with a lot of swelling to more of a color that is either a clear like color or starts to look somewhat like the same color of your skin tone. So when it comes to what your scar eventually looks like and the appearance of it, comes a lot down to your just genetic makeup. There's different approaches and different techniques that we can utilize to try to optimize the appearance of the scar and some other characteristics of it, but a lot of it is just going to boil down to your genetics. So if you've ever had surgery previously and have an incision or a scar from that, or if you have some close family members maybe who've had different incisions or surgeries, that can kind of give you a ballpark idea of how your scar might end up looking and the appearance of it overall. Of course, not a perfect test because it depends a lot on different body locations, and a family member is not going to be exactly the same as you, but just to give you kind of a ballpark idea and what to expect. So a couple different things to keep in mind just generally for scar management and to help with the scar healing. One is you want to stay well hydrated. This has a ton of benefits after knee replacement surgery, but especially maintaining good hydration and good fluids within the tissues that are healing around your knee and the scar is very beneficial. You may also want to consider that you have good adequate nutrition and good adequate amounts in your diet of calcium as well as vitamin C. These both have been found to really help with tissue growth and tissue repair. Some other things are, of course, massaging the scar. So the research to kind of support the benefits of massaging scar massage in terms of helping with the appearance of the scar and the long-term kind of look of the scar, it is inconclusive. Some studies show that there is some benefit and it does help with the appearance. Some studies show that it doesn't really do anything one way or the other. But it's relatively low risk thing to do, and so it's worth maybe spending 5 minutes every day or so doing some gentle massage to help with the long-term appearance of the scar. So when you do massaging of the scar and the tissue and the skin around your scar, you want to use a lotion or a cream or some type of oil. And of course, this should be like a topical type of oil or cream. And you can also get creams that have a lot of vitamin E in it. So any type of like a coconut oil or a coconut cream. These creams with the vitamin E, what it's supposed to do is help with collagen repair and collagen formation. So that connective tissue around your scar and within your scar. So the benefits of the vitamin E also maybe some mixed results in the research and in the literature, but potential for some added benefit with the vitamin E type oils or creams. Now, what are the benefits of the massaging and massaging with the cream and the oil? Well, one, it can help with laying down new collagen, new connective tissue, and helping with the alignment of that tissue. So it has good alignment as it's remodeling through that remodeling phase. It also helps to drain any fluid or swelling that you still have around the scar and around your knee. It can help increase blood flow, which again is going to help with that healing, help with the tissue remodeling. It also is going to help with the general elasticity of your skin, and it will help to kind of improve your comfort when you're doing range of motion, when you're bending the knee back. Instead of that uncomfortable stretching sensation, it might help improve that elasticity of the skin and comfort with that motion. And it's also going to help with the numbness that you might be experiencing on your scar or around the scar. So it helps improve kind of that, stimulates some of those sensory nerves around the scar and helps with decreasing that sensation of numbness. So when you are massaging after knee replacement surgery, you want to wait until at least 2 weeks, and some surgeons will recommend up to 4 weeks after your surgery. And the reason for this is, one, it helps the incision and the wound to heal and to close up. So you no longer have an open wound or incision, but it's actually has become a scar. Also, you want to allow some time for that tissue, that superficial tissue around your skin, the epidermis, the subdural tissue, to heal to some extent so that it can tolerate the pressure and the firmness from any type of massaging that you do on the skin without causing any irritation or damage. So the benefits of massage can last and be beneficial for up to 2 years, and this is based on that, again, remodeling phase of tissue repair. So this remodeling phase lasts for up to 2 years, so you can get some potential benefits and improvements with the scar tissue massage for up to 2 years after your surgery. So when you do the massage, what I like to tell people is just to keep it simple. So again, you want to use some sort of lotion or cream. It can really be any kind, but if you have one that has some vitamin E base to it, that may have some added benefit. And all you're going to do is apply some firm pressure and do just slow, continuous motions. These can be up and down motions, they can be side to side, they can be small circles one way or the other. Really any type of motion is okay, just that it's small, slow motions with a firm pressure. So you want pressure to be firm, but not too firm that it's causing any pain or discomfort. So typically you want to go all around the scar, along the scar, and the tissue surrounding the scar. And this typically takes about 5 minutes to do. If you're someone who's relatively early out from surgery, so within those first maybe 3 months to 6 months or so, doing it multiple times per day might be beneficial, 2 or 3 times per day for 5 minutes. As you start to move further out from your surgery, it is appropriate to maybe do it once a day or once every other day, depending on how your scar is healing and progressing and kind of what your goals are in terms of the appearance and look of the scar. Again, these benefits, it's hard to kind of quantify them or to tell the significance of the benefits of doing the massage and these other techniques that I described. A lot of it's going to boil down to your just general genetics and the makeup of your body, but the relative risk is relatively low as long as you're doing it appropriately, not too firm that you're causing any pain or discomfort, waiting until everything is closed off and healed a little bit. It is perfectly safe to do and has relatively low risk as long as you're following those guidelines. So I encourage my patients to do scar tissue massage once a day or so, maybe a couple times a day if they have the time to do so. And you might really notice some benefits in terms of improved elasticity, improved comfort around the scar in that area, as well as, of course, the appearance over time. So that's kind of my summary of everything related to managing your scar, your incision after knee replacement surgery, particularly in that time period while the tissue is in that remodeling phase. So this is not really discussing that short-term first couple of weeks where the management, of course, is a little bit different as the wound is healing and the incision is healing. This is talking about kind of that long-term management of your scar. Thank you very much for watching, everyone. Take care.